8 warning signs of blocked heart arteries in your legs and feet. The arteries that supply blood to your heart are called coronary arteries. When these arteries become blocked or clogged, it can cause chest pain, shortness of breath, and other serious symptoms. But did you know that before your heart gets affected, your legs and feet may give you warning signs of artery blockage? Here are 8 warning signs of blocked heart arteries to look out for in your lower extremities. Before we dive in, please take a moment to like and subscribe so you don't miss any future health tips. Also, this video is for educational purposes only, so do speak to your doctor if you have any medical concerns. 1. Swollen ankles and feet. Swelling in the ankles and feet can be a sign of poor circulation, which can be caused by clogged arteries. When arteries become clogged, it can cause blood flow to slow down or stop altogether. This can lead to fluid buildup in the lower extremities, causing swelling and making the affected area feel tender to the touch. Swelling in the legs and ankles is usually more pronounced at the end of the day, when you've even standing or walking around. This type of swelling can also be accompanied by other symptoms, such as skin discoloration and ulcers. If you notice any unusual swelling in your legs or ankles, it's important to see your doctor right away. 2. Changes in skin color. Changes in skin color, particularly in the lower extremities, can be a warning sign of blocked heart arteries. Healthy blood flow through the arteries gives the skin its color. When the arteries become clogged, however, this can reduce the amount of blood flow to the skin cells, resulting in changes in color. The affected area may appear pale or white due to a lack of oxygenated blood. Alternatively, it may appear red or purple due to poor venous return. In severe cases, the skin may even turn black due to tissue death as a result of lack of blood flow. It's important to note that changes in skin color can be caused by a variety of factors, including certain medications, medical conditions, and aging. However, if you notice any sudden or significant changes in your skin color, especially when accompanied by other symptoms such as swelling or ulcers, you should consult your doctor promptly. Early detection and treatment of arterial blockage can prevent further complications and improve your overall health. 3. Cold feet or toes. If you often feel cold feet or toes, it could be a sign of blocked arteries in your heart. This condition is known as peripheral arterial disease, which occurs when there is reduced blood flow to the extremities, usually in the legs and feet. When the arteries become clogged with plaque, it restricts the blood flow and reduces the amount of oxygen and nutrients reaching the feet, which can make them feel cold. Additionally, people with clogged arteries tend to have higher blood pressure, which can exacerbate the feeling of coldness in the feet. It's important to seek medical attention if you experience this symptom, as it can indicate a more serious underlying issue that needs to be addressed. By consulting your doctor, you can determine the underlying cause of the coldness in your feet and take the necessary steps to manage it effectively. Ignoring this symptom could potentially lead to more severe complications down the line. So if you're constantly battling with cold feet, it might be time to schedule a checkup and explore further. 4. Poor nail care. Poor nail care is another warning sign of blocked heart arteries. When arteries become clogged, it can affect blood flow to the extremities, including the nails. This can result in slower nail growth and changes in the nail bed that may be noticeable during a routine pedicure. Thickened, discolored or brittle nails can indicate poor circulation caused by clogged arteries. Additionally, people with clogged arteries may have higher blood pressure, which can also contribute to nail problems. If you notice any issues with your nails, it's important to consult with a healthcare professional, as it could be an indication of a more serious underlying issue that needs to be addressed. While poor nail care can contribute to nail problems, it's also essential to rule out other potential causes and seek treatment if necessary. Taking proactive steps to manage any underlying conditions and maintain good vascular health can help ensure that your nails stay strong and healthy. 5. Frequent leg cramps. Frequent leg cramps can be an indicator of blocked arteries, particularly in the lower extremities. When arteries become clogged, the reduced blood flow to the muscles can cause them to cramp up, leading to discomfort and pain. This symptom is commonly experienced by individuals who have peripheral arterial disease, a condition characterized by narrowed arteries in the limbs. People with clogged arteries may also experience other symptoms, such as swelling in the feet and ankles, as well as changes in skin color or temperature. If you notice frequent leg cramps, especially when you're inactive or during exercise, it's crucial to consult with a healthcare professional. They can assess your symptoms and determine the underlying cause, which may include arterial blockage. Addressing the issue promptly can help prevent further complications and improve overall health. 6. Hairy toes. Hairy toes may sound like a quirky nickname, but it's actually a serious medical condition that can be a warning sign of blocked arteries. This unusual symptom occurs when the arteries that supply blood to the feet become clogged, reducing the amount of oxygen and nutrients to the hair follicles. As a result, the hair on the toes stops growing and eventually falls out, leaving behind smooth, hairless toes. While hairy toes may seem like a harmless cosmetic issue, it's crucial to take it seriously, as it can indicate underlying vascular problems. Consulting a healthcare professional is essential to determine the cause and receive appropriate treatment. Addressing any arterial blockage promptly can help prevent further complications and ensure optimal blood flow throughout the body. 7. Numbness or tingling. Numbness or tingling sensations in the feet can be a warning sign of blocked arteries. This symptom is known as paresthesia and occurs when the reduced blood flow to the extremities causes nerve compression. When arteries become clogged, they restrict the supply of oxygen and nutrients to the nerves, leading to abnormal sensations such as numbness, tingling, burning pins and needles, or crawling. These symptoms often occur in the toes and the ball of the foot, but may also radiate to the lower leg and ankle. It's important to consult a healthcare professional if you experience these symptoms, as they may indicate underlying vascular issues. Addressing any arterial blockage promptly can help prevent further complications and maintain proper blood flow to the feet. 8. Sores that won't heal. Sores that refuse to heal on the legs and feet could be a sign of trouble with your heart arteries. When arteries become clogged, it can reduce blood flow to the limbs, leading to tissue death and ulcers. These sores typically appear on the lower legs or feet and take a long time to heal because of the poor circulation. People with clogged arteries may also experience other symptoms, such as swelling in the ankles and feet, as well as changes in skin color or temperature. If you notice any non-healing sores on your legs or feet, it's important to consult with a healthcare professional right away. They can assess the wound and determine the underlying cause, which may include arterial blockage. Addressing the issue promptly can help prevent further complications and ensure optimal blood flow to the lower extremities. While these warning signs may indicate a potential issue with your heart arteries, it's important to remember that they don't diagnose any condition. Experiencing any of these symptoms doesn't necessarily mean you have clogged arteries. However, if you do notice any of these signs, it's always best to err on the side of caution and consult your doctor. Early detection and treatment of any underlying vascular issues can help prevent more serious complications down the line. Remember, knowledge is power. The more you understand about your body and its warning signs, the better equipped you'll be to take care of yourself. So keep learning, stay curious, and prioritize your health. You only get one, so make it count. And until next time, stay healthy, stay informed, and stay in control of your well-being.